Welcome back from our first break. So, while we're on break, we were deciding that I actually was pronouncing it right in the French way. And you had a little southern twist to it.
Southern twist.
Yours sounds better, though. And it's easier off your tongue. The word concierge.
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 So, let's talk about that form of medicine. The traditional form of practicing medicine is like what 99% of us do. It's what I do. It's called volume-based. Will you define that for us and then explain to us what this hard-to-describe term is, or hard-to-pronounce term is, that really defines a more personal care approach. Not that you get bad care on the other model. There's room for both models to exist.
Right.
But help us understand, because this may be a model of medicine and will be a model of medicine that's growing in our community, and you're on the forefront of this, and so it's important that our public understands this new style of medicine, at least new to this area. It's incredibly successful in many parts of the world. All of my family, in fact, use physicians that practice like you, rarely like me. So, help define us what this is.
Yeah, great question. All right. So I lived in the volume side of medicine and founded a practice that was volume-based 35 years. So let's do point counterpoint. Some of the things that distinguish it, honestly, is time. Time is the most valuable commodity I think a person can have besides health, wealth, time. We only have so much in a day. And so if you give a good, well-intentioned physician time, amazing things happen. Amazing things happen. And my volume practice, a typical family doc nowadays, it probably has a census of between 2,500 and 3,000 patients. Mine was actually higher than that.
Wow.
The volume, it's changed so much over the years.
So how many patients would you see a day?
24, 25 a day. Now, when you're dealing with multiple complex problems in interacting, and multiple medications, and everything's multiple, you get worn out. And the average time a family doc gives to a patient is about 8 to 10 minutes. You spend more time waiting to see the doctor than you do actually seeing the doctor. So,
and we always run behind.
Yeah, because there's always oh, by the way.
Right.
And you do feel like, okay, I'll answer that question because it's a good question. But then, 5 minutes multiplied times 10 people in the morning, you're already an hour behind. And you feel guilty about doing that, but you want to give people time because you know that how valuable that is. So in the concierge model now, actually it's set up where a busy day for me is 8 to 10 people, and we give 30 minutes instead of the 8 to 10. So in 30 minutes, honestly, we can cover a lot of ground. And what I've done over the past couple of years, and we could talk about this in a different program, is I've become much more open to not just writing a prescription, because so many things can be accomplished without necessarily a prescription, but it involves lifestyle changes. We've seen amazing lifestyle changes, but you gotta have time to explain that to somebody. If you don't have time, then they walk out and they don't know really what to do, except the doctor said I'm supposed to do something, but I don't know what it is. So honestly, that time element is key. The personalization, I loved your segue to this about the person who's in the hotel or whatever, and making sure that every person has what they need. And MD VIP, the group that I'm aligned with, is MD Value in Prevention. And we do some amazing things. Honestly, Mark, I had to read up on some of these tests. I had never performed them before. But for our listeners, basically what it is this. If you're driving in your vehicle and you see red lights flashing on the dashboard, you have a couple of choices. It's a dummy light, don't worry about it. That thing comes on all the time. Or you can say, I wonder if that's important.
I better look into that.
I might want to take a look at that. Well, these tests that we do in the executive profile and an executive examination are so involved, so detailed, but they give me a window into what's going on. And honestly, one of the most rewarding things about this practice is not just that the patients have more time, that they get their questions answered, that there's a doc who says, there may be an alternative besides just another prescription. But they get an analysis that, honestly, it's with the big boys. You know, it's in the top 4 to 5 in the country in terms of executive examinations. So you're playing with Duke, you're playing with Johns Hopkins, Mayo Clinic, and it's come down that that's how detailed this examination is. So we've detected all sorts of things. I mean, vitamin D deficiency. Is that important nowadays?
Huge.
Vitamin D is huge.
Huge.
Because it gives us a leg up on that big bad virus out there. Okay?
Right.
It may define who has a good outcome and has not such a good outcome.
It may be the difference is, did you blow off your COVID infection or did you get intubated in the ICU? If you
Exactly.
have low vitamin D levels, it's not just for what I do to keep your bones healthy.
Exactly. It plays that role, but it's even more.
It's supporting your immune system is what we're talking about.
Exactly,
Yeah.
exactly. And here's the rub though. Insurance kind of, in a way, it works against us in many things that we try to do for our patients. And one of them is, if you read about vitamin D, like, Doc, I just checked my vitamin D. I've heard it's really important. If I run that test on you and you have no symptoms, basically what's going to happen is insurance is going to trip that out. It's going to say, you better pay for that.
Right, they won't pay for some of the
They won't.
testing.
So we're uncovering things that we didn't know were there. I mean,
Right. Because you have the time to do it.
yeah, and
So-
we're doing the investigation.
And that works because I try to do that in my practice as much as I can. And if somebody says, hey, by the way, would you take a look at this, something that they didn't make an appointment for, I will give them that time. And that's most of our patients, to tell the truth. So if I try to invest as much time as possible, you get great reviews for that. Everybody, in my reviews, I get wonderful reviews for not missing much or anything. And but I get trashed in my reviews that I'm always running behind, right? So you can't give as much time as every person needs on one end and not be criticized for running an hour and a half, sometimes 2 hours behind on the other, right? It's a catch-22, isn't it? Your model gives you the time and patient satisfaction.
Exactly.
Right.
Our patients spend 5 minutes waiting to see me.
Right.
Wow.
Just long enough to get their coffee, their water, or their whatever, and then they come in and